A study published in the Journal of Hospital Medicine, co-authored by 2 Yale doctors, indicates that one of the primary causes for thousands of COVID deaths is lack of hospital resources, including enough ICU beds. And early in the pandemic, a Connecticut city was among those that struggled with enough resources, the study says.
On that list of the top 10 communities was, in fact, Hartford, alongside places like the Bronx in New York, Manhattan, Camden, New Jersey, Detroit, Michigan, Philadelphia.
He's one of the study's co-authors and says if more hospitals had more than average resources,
that would have prevented, we think, 15,000 deaths that happened from COVID.
But he clarified that number.
That was 15,000 deaths in just April alone.
And he says it's a good thing that most subscribe to the practice of flattening the curve, which essentially resulted in spreading out the infections.
Had we not done that, it wouldn't have been 15,000 excess deaths in April. It would have been 10 times that number potentially.
But Yale New Haven Hospital fared quite well in the early months.
What we did at Yale, for example, was quickly change units that would have been previously used for patients, say, getting an elective surgery like a knee replacement, and turn it into a unit for COVID beds.
And they took nurses that perhaps had not worked in an ICU in quite some time and retrained them.
We took people that would have otherwise been taking care of patients at sort of outpatient centers and brought them back to the hospital.
Redeploying the workforce and beds, the key to success. In New Haven, Tony Terzi, Fox 61 News.
All right, Tony, thank you. Well, once again, Connecticut liquor